Hi, my name is Sadie Beal, and I'm a Sports Medicine 3 student at South Tahoe High School. For my fifth project, which is post-surgical rehab, I studied the post-surgical rehab process for a kyphoplasty. I'll start by explaining the spinal anatomy. The spine is composed of 33 bones, called vertebrae, divided into 5 sections: the cervical, thoracic, and lumbar spine sections, and the sacrum and coccyx bones. Intervertebral discs separate each vertebra. Each vertebra is made up of the vertebral body, a superior anterior, a superior articular process, a transverse process, a spinous process, an inferior articular process, a pedicle, a vertebrae foramen, and a lamina. Fractures are most common in the vertebral body. Vertebral fractures are usually caused by osteoporosis or trauma. They are extremely rare in most people, but are very common in people with osteoporosis. If they are left untreated, there can be severe consequences such as permanent spinal cord injury, nerve damage, and even paralysis. A lot of the fractures are minor and can be healed without surgery by wearing a brace, but some of them are more severe and need surgery in order to heal and prevent further injury. Most of the fractures occur in the thoracic or lumbar spine, and the most common symptoms include back or neck pain, numbness, tingling, muscle spasm, weakness, bowel or bladder changes, and paralysis in severe cases. As for the treatment and surgeries, patients always need an x-ray to diagnose the injury, but sometimes an MRI is also needed so the doctor can examine the areas around the injury. If surgery is needed, then the patient has to get a CT scan as well. As I stated before, most minor fractures won't need surgery and can be treated using a brace. Almost all patients have to take NSAIDs and sometimes even stronger prescription pain medications. If the fracture is caused by osteoporosis, the patient will also be prescribed osteoporosis medications. If surgery is needed, there's two options: vertebraoplasty and kyphoplasty. The main difference is that a kyphoplasty corrects collapsed vertebra and decreases the risk of the patient becoming hunched over. As for an intro to what a kyphoplasty is, it's a surgery with a 96% success rate that is done to treat spinal fractures, mostly compression fractures. It helps to restore a damaged vertebrae's height, relieve pain, and fix a fracture. It generally takes 1 hour per vertebra being fixed, and the patient is usually awake but under local anesthesia. Sometimes the patient is under general anesthesia, but local anesthesia is much safer. The full recovery time is fairly short and usually takes around 6 to 8 weeks. As for the procedure, first the patient is prepared by being given local anesthesia. They are positioned on their stomach with their chest and sides supported by pillows. The area undergoing the surgery will be cleaned and prepped. Next, a half-inch incision will be made in the skin over the fractured vertebra. With the help of a special X-ray tool called a fluoroscope, which allows the doctor to see where the needle is positioned, uh, one or sometimes multiple special needle-type instruments with a small balloon on the end are inserted through the bone using either a twisting motion or a tapping mallet. The needles are angled to avoid the spinal cord. Next, the surgeon carefully inflates the balloon to the needed height, then proceeds to deflate and withdraw the balloon, which leaves space in the vertebra for the cement filling. After that, the needle injects bone cement into the cavity made by the balloon from the bottom up. The pressure and the amount of cement injected are closely monitored to avoid leakage into unwanted areas. While complete filling of the vertebral body is ideal, it is not always possible or necessary for pain relief. The needles are withdrawn before the cement hardens, and the small incision is closed with skin glue or steri strips, which are small stick-on bandages that fall off on their own within 2 weeks. The patient isn't moved from their position until the cement in the mixing bowl hardens, which is an indicator that the cement in the vertebra has also hardened. Here's a video of the kyphoplasty procedure. As the main goals of rehab after kyphoplasty are to improve posture and gait, increase balance and back flexibility, and increase back strength as well as leg and arm strength. As for an overview of the rehab, it is extremely important to educate the patient on proper breathing techniques and posture. That's why all of the phases focus on posture and gait. Unlike the rehab programs for other injuries, the rehab process for kyphoplasty only has 3 main phases. The first phase focuses on stretching and breathing. The second phase focuses on proprioception and flexibility, and the third phase is advanced strengthening to return to full activity. Immediately after the surgery, the patient will receive pain medication, usually NSAIDs, but sometimes a stronger prescription pain medication. The patient is typically on bed rest with very little movement for at least 24 hours after the surgery and shouldn't be lifting anything over 5 pounds. The patient can do small amounts of walking, but shouldn't do very much. Sometimes patients need to wear a Jewett brace, which is pictured here. The first phase of rehab focuses mostly on stretching and breathing and lasts from weeks 0 to 2. During this time, the patient should be educated on the back and its anatomy, as well as proper posture. It is important that none of the stretches or exercises involve much movement or twisting of the back in order to let the injury heal. During this time, you can do exercises such as ankle pumps and short arc quad sets to make sure your legs are being stretched without the risk of injuring your back. The patient should also work on diaphragmatic breathing, which is where you expand your abdomen as you inhale and contract your abdomen as you exhale. It is important to do this because the abdominal pressure generated by the activation of the muscles you are using helps to stabilize the spine from the front. The patient can also walk short distances up to half a mile during this period. The second phase of rehab mostly focuses on proprioception and flexibility and lasts from weeks 2 to 4. During this time, the patient should continue to be educated on the back and proper posture, and also be educated on proper walking form and how to do everyday tasks, such as driving a car, while recovering. In order to regain balance, the patient can do exercises such as a single leg balancing and tandem walking. It is also important that the patient strengthens their hips and quad, as well as the rest of their legs during this, so it is easier for them to get back to walking longer distances. Some ways they can do this are butterfly stretches or quadricep stretch. The patient can work on increasing the speed of their walking and the distance they're walking as long as their doctor or physical therapist is okay with it. The final stage focuses on advanced strengthening and lasts from weeks 4 to 8. The patient should continue to be educated on all of the things that were being taught before, but also be educated on how they can prevent themselves from further injury in their sport or even just in their everyday activities. They should be evaluated to make sure their posture and gait are proper. In this stage, the patient can begin to work on getting back to their everyday life and exercises. They can begin to lift more weight, up to 15 pounds. They should work on strengthening their back muscles by doing exercises such as bridging with an unstable surface such as a yoga ball, which helps to prevent further spinal injuries. They can continue to strengthen their legs with exercises such as lunges and can also strengthen their core to prevent further back injury, and to help them heal by doing exercises such as planks. Once this stage is over, they should be able to return back to their normal life with some precautions such as not lifting anything too heavy and making sure they don't have bad posture. To conclude, the rehab for a kyphoplasty is different from other rehabs because it involves just as much education and posture as it does exercising. The exercises focus on strengthening not just of the back but the entire body. If the patient isn't taught proper posture and breathing after the surgery, they're at high risk for another vertebrae fracture. Thank you.